knee straight, turn the hip out, beautiful, bring your legs out, hold the table, and resist. Good, okay, really good. And then I just go back and I just want to see range of motion. Now she has much better range of motion here, right? Okay, because glute max is an external rotator, and multifidus works with the multifidus works with the glute max. Because I wouldn't wait for a third session with you, because I'll never see you again, maybe, unless you come back in December. But so turn your neck to the left all the way, and take this leg and keep it right here. I'm going to slide it in. Ready? Resist. Beautiful. And then keep this leg right here. Ready? Resist. One more time. Resist. Yeah. So keep that leg there. Keep that neck there. Remember I just did the psoas thoracic division. Hold it right here. Ready? Resist. Yeah, everything's just shut down. Go neutral. And then same thing. Keep it right here. Ready? Resist. It's so strong, right? So you have a neck issue that could be affecting all your low back. See how I just tested that and found it out?
Yeah, and they said, the doctor said that's what's making my hand and shit go numb.
Yeah. So, so you test the deepest muscles first. So I'm gonna go with the longest capitis on this side. So just slight rotation. Yep, no, you're good. Chin down, tuck it, like really tuck it. Now lift your chin up to your chest, as high as it'll go. There we go. And now keep your chin on your chest. I'm gonna separate it. And what I'm doing is like, it's a cocking motion. I'm not just pushing down, I'm trying to uncock it. Ready? Resist. One more time. Ready? Resist. And so the back of my hand acts as like the axis, and I'm just trying to cock it. Okay. So that was weak. Now, this longest capitis, this is actually going underneath the trachea. So I'm literally pushing the trachea out of the way, and I'm going right into the cervical vertebrae. Not if you do it right.
I know, I'm scared of it.
But if you do it wrong, they die.
I know, that's right.
Yeah, they just cough. That's it. What's coughing? Now, you do the first four articulating processes of the vertebrae, but when you get the basilar part of the occiput, it's literally up right where the foramen, the occipital foramen, where the hole is, where the brain stem comes out, right? Or the spinal cord. So you go up and in at a 45-degree angle, and you feel that right there? You feel that right there? That's your spinal cord. No, we don't touch it. So you get close. Okay, beautiful. Isn't that fun?
Oh, that was really weird.
Okay, so slight, chin down, and then lift up, hold it right there, and resist. Okay, better. One more time, resist. Okay, better. Now, let's do this. Full flexion, full rotation, chin up, and okay, and then just slightly side bend. Yep, I'm gonna go from ear to ear, like that, in a cocking. Ready?
Yeah.
Resist. And that's, oh, wow, very good. Show off. Obliquus capitis superior, one of the suboccipitals. So those are the two deepest of the muscles. Now I'll do the SEM and the scalene. So 45 degrees, chin, 45 degrees, chin up, lift your head straight up, and I'll guide her, because again, when you're on a table, like what's straight up, so I guide them. I want that muscle to just be lined up with the axis, and I'm gonna push your head straight down. Resist, and no. One more time, resist. No. Okay. So SCM, not doing enough. So right on the mastoid, this is the easiest one because it literally tells you where it is, right? It's the one you always get right in like anatomy class when it came to the test. Where's the SCM located? SCM weakness could be a relationship with vertigo.
No kidding, wow. So many people.
But I've been known to make a lot of stuff up, so.
So many people have vertigo.
Yeah.
They told me I did. I was just sitting there, got dizzy, passed out.
Yeah. Okay. So 45, chin up, and then straight up. Hold it up, resist. Good. Okay, bring it down. And then upper So I always like to do the test, like the shoulder, right? And And so no medial rotation, right? It should be literally probably, it's 70 degrees of acceptability. Relax. There. That's what a good shoulder would look like, okay? And that's not what a good shoulder would look like. That's just literally glenoid fossa, glenoid, or the head of the humerus on the glenoid fossa. No, it's stopped, right? So upper trapezius, elbow straight. So turn medial rotation. Thumb is pointed towards the ground. Abduct along the plane of the table in the frontal position. About 120 degrees of abduction. I'm gonna push straight back down along that plane of the table. Ready?
Mhm.
Resist. And keep it medially rotated. There we go. And resist. So what happens is people will try to come out of medial rotation to be strong and they'll externally rotate the shoulder. And that's those compensations you need to look for. So now I will get along the spine of the scapula.
Isn't that what you did to me?
Probably. I forget which one I did on. I did do some sort of muscle energy technique type of thing. I know what they do, but I don't even know if that's what I did. It's what I did is I had you isometrically rotate, but when you put your finger on the S2, it unlocks that.
It works. It's something I wanted to learn.
But remember, that's all still stretching.
Right.
You know. Oh, that's right. I didn't show you the example of stretching. I won't do it on you. I'm putting you together. Don't undo my work. Remind me. And specifically hamstring stretching. I'll do it on the hamstring.
What are you doing there?
I'm going to do it on AMY because she's so flexible. What am I doing? So I'm going up the nuchal ligament or the ligamentum nuchae. So that's the trapezius. And then it attaches on the superior nuchal line. So when you find the EOP, the external occipital protuberance, you just go lateral to that. And that's where your trapezius attaches. And then immediately rotate, bring it up, hold it right there, and resist. Beautiful. One more time. And resist. Beautiful. Now relax. And again, everyone would say, oh no, you didn't push as hard. Relax. And good. So there we go. Now below the table. Pretty good. So that's an opposite side rotator. And keep this leg right here and resist. Good. And then keep your head there the whole entire time. Ready? Resist. Beautiful. And I would just test everything with her neck turned, bent. If I did this in the beginning, maybe everything would have been shut down. Turn, pull this towards me. Here we go. And resist. Beautiful. And then adductor magnus. Okay, so squeeze your legs together. I'm gonna pull it away. Resist. Good. TFL. You okay? I'm gonna push down and in. Stop me. Beautiful. Go. You can go neutral. Yeah, go neutral. Okay, really good. Oop. She got better on that. Don't ask me why. But yeah. So then, what I'd have you do now is just I get you off the table and I do a series of exercises, and then that'd be it. And then we do another session again, and it would be less here, more on the 5 or 6 pieces of exercise, and then hardly anything on here, more than 5. But I can't say you're going to get up and go, oh my God, I feel so much better. But again, it's like that would be a treatment.
What exercise?
Well, just the basic ones like a leg press or a squat, a chest press, a pull down for the back muscles,
For beginners.
shoulder press. What?
Beginners. For beginners.
Beginners?
Yeah, yeah.
Anybody. Like there's the 5 or 6 major muscle groups that you would always do. It's either a squat or a leg press.
Okay.
They're both good.
With weights. Squat with
As
weights.
much as you can handle with good form. Can't just use like a dinky weight. But yeah, do that. Grab my forearm and sit up. And drink water. Okay, so the hamstring tests are from 75 degrees of knee flexion and like 45 degrees, knee flexion and hip flexion whether I medially rotate the tibia or laterally rotate the tibia, it's testing a different muscle. With medial rotation of the tibia and 75 degrees, it's a semitendinosus. With 110 degrees, it's a semimembranosus. You don't need to know this, but. So I'm gonna test and just try to make sure they're all strong, okay? So I'm gonna pull up, ready? Resist. Beautiful, nice and strong. And I'll just do bicep femoris. So bicep femoris, it's the same position, just I laterally rotate again, because then the muscle is lined up, right, with the fibula. I'm gonna lift up. I'll show you first. I'm just gonna lift up. Ready? Resist. Okay, so we can say they're pretty good, right? It's gonna be hard because again, she's very flexible, but tell me where end range feels like a stretch. About right there? Starting to feel resistance.
Yeah, that hurts a little, yeah.
So let's just hold this for like 30 seconds. Someone got to watch?
That looks
Right.
painful.
That's tight. You're not flexible.
It's my left!
Kidding. It's not hurting though, right?
It's hurting.
Back off just a little bit. And if you ever done PNF stretching, proprioceptive neuromuscular. So push into my hand for like 10 seconds. Push, like you're almost trying to bring it into extension. Push, 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 and relax. And relax, and you can say, ooh, you got 2 degrees more. That was 30? Okay. So then I take her out of that. And keep your leg right here. I'm gonna lift up, ready, resist. And she's lost all that contraction. Resist. Yeah, one more time, and resist. It feels like it's harder to contract. So again, you're not getting looser, you're shutting down 30% of its contractile force. A guy named Paul Chek, C-H-E-K, he's off the deep end now because he was a fitness, he certified personal trainers. He has the Czech Institute, levels 1, 2, always levels, right? Oh. And by the way, his certification is Corrective High Performance Exercise Kinesiologist. His last name was his acronym for his certification. You can never go to somebody that's egotistical, right? Yeah, so egotistical. Mine should be tutorial and just like torque, or just make it all out. Wow, it's a fancy certification. But no, but he did the studies, and it's all published now. You're losing up to 30% of your contractile force from stretching. But we always tell people, like, what type of stretching don't we do now? We know better. We don't do like the static stretching, right? You know, the one where you hold something for 30 seconds. They do more ballistic, like when you're warming up. A football player, if you ever watch the people that do like field goals, right? The what are they called? The extra pointers?
Kickers.
Kickers. Is that what they're just called?
Yeah.
They're just kickers?
Yeah.
Okay. So, you know, they'll sit there and they'll warm up like this. And then it gets a little bit higher and a little bit higher. And then so sometimes like the coach will be like, get ready, you're gonna go in because they're on the first down, but they're getting down the field and they might have to kick the field goal. So you start preparing like a few plays before it. You don't see the guy sitting there like, you know, crossing the leg and, you know, doing all that kind of stuff. They don't do that stuff. And when they do it on the field, you know, they're doing more ballistic, like stretching, like it's stretching, but it's more ballistic. And that they found that to be way better than static, like stretching. Resist. Better for blood. What is this?
Well,
Blood flow. Where do you think blood is not going?
Oh, I mean, when you warm up before you run, it's to warm up the muscles and get the blood flow going. It goes to the brain, it makes you
See,
think.
I heard
yeah.
that stretching after exercise, if you're like stretching before exercise, you don't need to do that.
You're supposed to
Take
warm
a couple,
up.
you know, take a couple breaths.
And jumping
Do a little,
Jumping
and you're
jacks.
warmed up. But
Yeah.
stretching after
Is the important
supposed
one.
to, it creates longer, leaner muscles. That's
Yes.
why dancers have nicer bodies than like football players, because,
Yeah, that's actually not true though. You know why?
sure.
One of the benefits of massage when you go to school, increased blood flow. That's one of the number one things you tell
What?
people.
Increased blood
When
flow,
you,
that's our
when you
thing.
go to
That's
massage
something,
school,
yeah.
when you tell people the benefits, increased blood flow. That's
Yeah.
one of the things you're told to tell people.
You know, if I took a knife and cut you everywhere, you're gonna bleed. So your blood's flowing.
I know. But
Not like I'm
maybe
gonna hit you one place and be like, oh, it's not bleeding. We're bracing the calcaneus and a little bit of that malleolus, lateral malleolus. I take my left hand and I just brace the tibia just lightly. I don't squeeze or
She's got
anything.
a sensitive spot on there.
I have a
sore.
wound, but it's not hurting.
Am I touching
you're
it?
gentle. And I
No,
just,
you're fine.
I had an implant. It
Okay.
is fine. It's been a
Am I
six,
touching
six
it now?
months. It's fine.
Okay.
It's fine. No worries.
All right,
now.
and then I just have her medially rotate, but I guide, and again, I'm not pushing the ankle, I'm trying to guide the femur into medial rotation. And then I can stay on that foot, and I can now take my left hand and put it on the calcaneus and try lateral rotation.
That's
Did I
how
hit it?
Here,
Oh, okay.
it's getting better, but it's still sore.
Yeah, I'm sorry. All right. So I can do lateral rotation. Then I can switch over to the right side, and I take my left hand and I brace the calcaneus, and I guide with my right hand on the tibia, and I do that. And then I take my right hand, brace the left hand on the tibia, and I externally rotate it, and I make a note. When you get really comfortable, you don't have to do that, because I can just do this, and I can just do this. And I can look at the patella as my guide to know if I'm getting the femur to rotate. And when I get medial malleolus, you're bracing the opposite side ASIS, and you're gonna let them know, don't relax, I'm gonna go down and away. Hold it right up. Ready? Resist. Beautiful.
Good.
Put your why you put your hands behind your head? I'm waiting for an answer. I will not move on until somebody.
To hold my head.
Yeah, why? What's the matter with your head? What you're doing is creating a longer lever system, right? So you're making it more of a challenge, right?
Okay.
Put your arms straight over your head.
Oh boy.
Not try to do a crunch.
Yeah,
Like,
right.
Really hard to do, right? You
Yeah,
change
right.
the center of resistance, right? Okay, you're good. That was good. It was all momentum. All right, so put your hands on your legs. Don't you give me an attitude like that. Here's your starting position. Come up a little bit. Straighten your elbows out. Lock them. Okay, there's your starting position. Now, the first thing you want to do is engage the abs. Here's your abs, right? I want you to slowly you're going to slide your hands right up to your knee when I tell you to. Go. Slow. You didn't even get up there. Ready? Come up, come up, come up. 1.
Oh, the whole way up.
And down. 2, slow, much slower than that, but come on. 3, hold it, and then down. Feel that in the abs? A little bit more. 4, slow, come on. 5, 6.
How
You
should he
try that
breathe?
now.
She needs
7,
exhale.
slower, 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 go. 8, good, slow, slow breathing. Now, you feel that more in the abs now? Yes or no?
Yeah.
Okay. Now take that.
Yeah, like up through.
Take that speed and cut it in more, so slower. Stop putting your hand behind you. But anyway, that's a crunch, right?
Wow.
It's much slower than you do. Well, look, nobody does bench presses like 1, 2, 3, 4, 5, 6, 7. But everyone does crunches like boom, 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 boom,
No,
boom.
you've
They do
been in the
crazy
gym,
abs,
you've
right?
seen guys do that. We've got this guy, I call him Jackrabbit because he's.
Yeah, they're like wonderful. But now start from.
Made it harder,
Now
didn't
your
it?
shoulders are off the ground. Your shoulders are off the ground, and there's your starting position. That's basically almost where you finished,
Okay.
right? So now slide up. Come on, seriously. There you go.
All right.
It helps if dangle a Twinkie. Like, come on. All right.
Snickers.
All right. So hold on. Now the lower leg lift, right? The leg lift, right? What are you doing?
I'm so not to listen to you.
So in the physical therapy world, they would analyze core strength by doing this type of assessment, leg lift. Now what they wanted to do, so who, can you stand up above her? Okay, lie down. Now this would be done on a table, but you can't do it on this table because they're really flat, but they do it on their tables. But lay down, grab her ankles.
Put your arms up. Nope.
That's adorable.
Grab her ankles.
Are we gonna do a roll?
The other way it gets really weird.
Oh, I don't know, this thing too.
Okay, so bend your knees. All right.
I think I
Now,
have a set of playing cards with that on it.
what you do is you put your hands underneath the lumbar, okay? Now, push your lumbar into my hand, like flatten your back out. Now lift your legs straight up in the air. Straight up. All right, now I can't wiggle my fingers, right? Okay, now slowly bring your legs down to the ground. Stop. You've already lost core contraction. You see how you've already started the lumbar extend? She didn't even move an inch or two before she lost the ability. And the further her leg goes down, the more she hyperextends her back. So this ab exercise that people are doing, the leg lift type of thing, is actually responsible for more back pain because people, I don't even have any of my clients do it. The only clients that I've ever worked, I worked with a guy named Shannon, no, not